I mean, giving calcium to someone with osteoporosis doesn't fix their bone.
Right.
A bone is a collagen base. Okay, so the structure is a form of collagen. There's a collagen structure framework, and then calcium and phosphorus get stuck on there. Now, if a person is amino acid deficient, if they're protein deficient, the collagen structure starts to break down. And so instead of, if this was like the collagen structure and we were going to stick bone on there, and now because of breakdown, 30% of that structure is gone. Let's say going from 20 to 60 years old.
Yeah.
30% of the lean body mass, and so 30% of the bone mass is going to be part of that. That now you've only got this left. You can take all the calcium you want. It's not going to make a difference. You're not going to rebuild the bone.
Right.
You have to give the osteocytes, the osteoblasts. These are the bone cells that make bone. You have to give them amino acids, and they make this, and they make this, and they make this, and they make this. And then you got enough vitamin D, and you got enough calcium, and you got enough testosterone, and you got these various things that are important in this, and now you make new bone. And now the bone density, and you give them, you got to give them enough exercise, or you stress it a little bit.
Right.
Deadlift, squats, things like that, where they start to build bone. Now you do their bone densities a year later, and it's like, oh my God, we're not osteoporosis anymore.
Wow.
The bones are healing.
Incredible.
But the important thing is amino acids, and virtually nobody who leads the field of osteoporosis is talking about this at all.
Nobody.
They're pushing medications that don't really make new hard bone. So this is the key to it.